Knock knock.
Come in.
Hi, my name's Carly. I'm going to be your nurse today. How are you?
I'm doing well. How are you?
Good. Providing privacy, doing hand hygiene. Can you confirm your name and date of birth for me?
Rosie, May 3rd, 2006.
Perfect. That matches with your wristband. So, the doctor today has just ordered a full head-to-toe assessment on you. Is that okay?
Yes.
Alrighty. So, getting started, noting your orientation. You're pretty well oriented. You're talking to me. Level of consciousness. You're awake, alert. All good things like that. And looking at you here, I don't note any obvious physical deformities, and you're appropriately dressed for the weather, and you're groomed pretty adequately. And then looking at your facial expression here, pretty neutral, happy, I might say. And you are alert and making eye contact with me, so that's good. And then your hearing, can you hear good for me?
Yes.
Okay, speech is good, speech is there. And do you have any eye concerns at all?
Mm-mm.
Alrighty. Now moving on to that skin and hair and nail assessment. Looking at your scalp here, there's no dandruff, no scabs or anything, and your skin is all intact. Not skin. Your hair is all there. It's nice, thick, and now looking at your skin here, it is free of lesions. It's nice and warm, dry, very little oil, and you do have a few macules noted here and a tattoo, and let's see if that skin trigger. Perfect, reverts back immediately. And then can I see your nails? Okay, they are slightly curved, translucent, they're clipped, they're not dirty or anything, so hygiene is good with that. If using the Braden scale, a few risk factors for skin breakdown are nutrition, mobility, and moisture. Moisture is just a really good environment for bacteria to grow. And mobility, you just want to make sure you're getting up and out of bed a lot, because those, yes, staying in bed, it just creates a lot of pressure for, you know. And then nutrition, if you're malnourished, it's just really hard for your body to heal, okay? And then do you have any concerns with your skin at all? None? Okay, perfect. So now we are going to move on to the HEENT and neurological assessment. Looking at your head here, it's round, normocephalic, nice and midline. Yes, your facial features are symmetric. And do you have any history of facial drooping?
No.
No? Okay. So now we're going to move on to hearing. Your ears are symmetrical on the face. They're both there. No cerumen noted. Do you have any tinnitus or trouble hearing? No? Okay, so now we're going to do a whisper test. So just repeat back to me what I say, okay? 420.
420.
Okay, same thing on the other side.
Pony.
Okay, perfect. So now we're going to move on to those eyes. Looking at them here, they are nice and symmetric. And then I'm just going to shine this on your eye, okay? Okay, doing direct. Pupil dilated nicely. Now doing consensual, looking at the other people. That one dilated good as well. And now just follow the pin for me, okay? Perfect. And then your pupils are about 4 millimeters in size. 4 millimeters in size, and they react nicely to light, and they're round. And do you have any trouble with vision, wear glasses or contacts?
Nope.
Okay.
20/20, baby.
Really? Okay.
I think it's actually better than that.
Look at you. Can you open your mouth for me? Okay, oral mucosa is nice, pink and moist, and no teeth missing, no cavities noted. Looking at your neck here, trachea is midline, no JVD present. And do you have any trouble swallowing at all?
No.
Can you swallow for me?
I just did it. I have a hard time swallowing twice in a row.
You're fine. Try.
I can't think about it. This has always been a problem.
Okay, perfect. And then can you just close one nostril and sniff for me? Same thing on the other side. Okay, nostril patency is good. And do you have any nasal drainage at all?
No.
No? Okay, perfect. Can you tell me where you are?
At the hospital.
Do you know why you're here?
For a checkup.
Okay, what month is it?
March.
And who's the president?
Child.
Okay. Alright, so you're oriented ×4. And are you aware of what the Glasgow Coma scale is?
No, I'm not.
Okay, so it's just a scale that we would use to assess you after a brain injury. It's just going to assess your eye movement, how well they're moving and reacting, as well as your verbal and physical responses to stimuli. And then, okay, so when we did your vital signs earlier, noting your respiratory rate, it was 14, it wasn't labored, and that rhythm was regular. And do you have any cough or sputum? No? Okay, are you having any sort of shortness of breath?
No.
No? Okay, so I'm going to listen to your lung sounds if that's okay with you. Every time I touch the stethoscope to you, just breathe in and out for me, okay?
Okay.
Alright, right here I am listening to the right upper lobe.
I felt that burp coming.
The left upper lobe. Left lower lobe. Right middle lobe. Can you raise your arms for me? This is the left, or the right lower lobe. The left lower lobe. Okay, you can do your own sound.
My coffee breath.
On the back here, I'm listening to the left upper lobe. Right upper lobe. Right lower lobe. And left lower lobe. Alrighty, perfect. Your lungs sound clear in all lobes. There's no crackle, stridor, or anything like that noted. And then, do you know what the turn, cough, and deep breathe method is?
You turn on your side and you cough and you breathe as hard as you can to expand your lungs.
Okay, perfect. Yeah, so exactly what you said. We'll turn you on your side, have you cough and take a big, deep breath. And that's just going to clear your lungs of any secretions and get those lungs nice and expanded. And then, do you know what incentive spirometry is?
No.
No. Okay, so instead of spirometry, it's just a little device that we would give you. You would inhale into it, and all that does is just expand your lungs, get them working nice. And you want to do that one about 10 times an hour, but not all at once because it can make you really woozy, okay?
Okay.
Alrighty, and now onto the cardiac assessment. I know I did this in the neck assessment, but looking here, no JVD present. Can I see your hands for me? Okay, capillary refill, less than 3 seconds. No edema noted on the upper extremities. Right here, you would have your carotid pulses on each side, the axillary, the brachial, and then let me feel your radial. Okay, radial pulses are palpable, 2+ regular rhythm, and then you have your femoral pulse points right here in the groin area, the popliteal right behind your knees, and then I'm also going to feel on the toe of the feet, okay? So this is your dorsalis pedis. Okay, 2+ regular rhythm, and then your posterior tibial. 1+ regular rhythm, and then no edema noted on those lower extremities. Do you have any chest pain at all? So now I'm going to listen to your heart. You can just breathe normally for me, okay? Right here, I'm in the second right intercostal space, listening to the aortic valve. Okay, second left intercostal space, listening to the pulmonic valve. Third left intercostal space, listening to Erb's point. Fourth left intercostal space, listening to the tricuspid valve. Okay, and then finally, your mitral valve in the fifth left intercostal space. Alrighty, your heart has a regular rhythm, and S2 and S2 and S1 are present in all of those valves, so that's good. And then, okay, now on to the GI assessment. Just looking at your belly here. Looks nice and soft. There's no masses noted or anything. I'm just going to take a quick listen, okay?
Okay.
Here I'm listening to the right lower quadrant. Right upper quadrant. Left upper quadrant. vowel sounds on the normoactive, and I'm going to listen for any venous sounds right under that xiphoid process. Or venous sounds. Alrighty, perfect. And then when was your last bowel movement?
Maybe an hour ago.
Okay, and then did you have any trouble with that? Okay, and are you having any trouble urinating at all?
Nope.
Okay, so now we're going to move on to the musculoskeletal assessment. I'm just going to feel on your elbow joint here. Can you touch your shoulders for me? Alrighty, now extend them back. Okay, same thing with resistance. Touch your shoulders for me. Okay, now extend them back. You're fine. Okay, now we're going to do kind of the same concept with your wrist. Can you try to touch your forearm for me? Okay, put them back where they were, and then hyperextend them. There you go. Same thing with resistance. Try to touch your forearm. Okay, and then try to come back. Perfect. Now, can you just extend both of your knees for me? Alrighty, put them back. Perfect. No crepitus noted. Neither of these joints I've assessed. And then same thing with resistance. Extend them.
Y'all knocked my doctor over.
And then flex. Perfect. Now, you do the same thing with your ankles. Can you point your toes up to the sky for me? Alrighty, now point them towards the ground. Okay, now same thing with resistance. Okay. Perfect. Now, can you stand right here for me? Okay, can you walk from the door to right there? Alright, can you walk back heel to toe for me? Alrighty, you're fine. Perfect. So gait and balance are perfectly normal.
I'm not drunk.
Now, are you having any pain in your joints at all?
Nope.
No? Alrighty, perfect. Alrighty, so that is everything we've had for you. You did a wonderful job. Thank you.
You're welcome. Thank you.
Thank you.